Hello, good evening, everyone. We are back with our Saturday night live webinars, known as Evinars because it's Evrox Healthcare. And let me give you a brief introduction about Evrox Healthcare. Evrox Healthcare is a digital teleconsultation company, and you can have your demos. I mean, I'm talking to the nutritionist, to the doctors, to the medical healthcare workers, to the mental healthcare workers, and everybody else out there who are in healthcare. They can actually log on to this and they can sign up on the app that is coming up, is known as the F1 app. And once you do that, you will be getting teleconsultations from all over India, maybe even globally. So, moving ahead with our webinars, today's topic is surgical strike. So, we are going to talk about, basic general surgeries and what is the pre-op preparation, the post-op preparation, what is necessary, what is anesthesia, what is not necessary, what are the investigations that need to be discussed pre and post-op, and everything related to basic surgeries. And for this, we have a very impressive surgeon amongst us, Dr. Mukund Thakur. He belongs to Nagpur and he was the ex-president of Weather Surgeons Association expert guide at Amasi Skill Course and Fellowship. He is very much interested in minimal access surgery, advanced laparoscopic and thoracoscopic procedures. He has given so many paper presentations and publications that I can't even name right now because there are so many. The list is endless. And he has been organizing a lot of faculty workshops and even for other surgeons who are budding, and his original research works have also been very unique. His field of interest have been advanced laparoscopy, laparoscopic oncosurgery, lap hernia surgery, bariatric surgery, and thoracoscopic surgeries, as I mentioned earlier. And he was the one who, in fact, performed my own appendectomy a few months back. So please welcome Mukund Uncle, who is very dear and near to me, and we work at the same hospital. Dr. Mukund Uncle, you're welcome on the screen.
Hello everyone. Nice to see you, Surabhi.
Thank you all hail and hearty because of you and the surgery that you performed on me. I am feeling much better now. So thank you for that. And to begin with today's topic, so let us begin with the very basic and generic questions. So and we will not use a lot of technical terms because ये program हम लोग common public के लिए कर रहे हैं. So we will use English as the language, and we will talk in non-technical, non-medical terms for people to understand easily. So
Right.
starting with G. What is a basic surgical operation and what are the preparations that a doctor does for the operation and the patient also has to do for the operation?
Uh, you see, there are different conditions which need surgical intervention for their cure. The conditions can be as simple as corn on the foot to something very complicated or difficult situation inside the brain which needs to be treated with surgical intervention. So all this spectrum is covered under surgical conditions. Different surgical conditions which the patients suffer from, they have to take opinion of different surgeons who specialize in their treatment. So because these conditions are treated by different specialities, those conditions which are important from the point of patient, we will be discussing in today's webinar. And being a general and laparoscopic surgeon, I will cover certain conditions which need to be treated uh, or which are required to be treated very, very commonly. Like the one which you suffered, Surbi, appendicitis. Appendicitis is a very common disease which uh, a number of people suffer from, and it needs immediate surgical intervention. And on the other hand, the condition like hernia is one which can wait for elective intervention. Uh, Being a surgeon, I would like to say that even a small surgery or a big surgery, we try and make the patients comfortable with the help of different anesthesia agents, and we take help of different people uh, like anesthetists, our surgical assistants, our nursing staff, our OT attendants inside the OT, who are equally important to run the operation theater. Does that answer you?
Yes, absolutely, it does. So basically, we need nursing staff, we need the entire OT staff, we need anesthesiologists to help the
Very true.
surgeons. Yeah. So it's not a one man, show. It's basically an entire teamwork that's
Yeah.
there. So, okay. So now we do a lot of pre-operative procedures and pre-operative investigations basically. So are they necessary? And basically, if so, what are they?
Okay. Well, it's a very good question because in my practice, I come across number of people who come to my clinic and tell me that I have come prepared for a surgery and you do it right away. Now they have already consulted some people and he is aware that his condition needs surgical intervention. But for me to decide whether I should do it immediately or not, I need to have some basic parameters about the patient. There are patients who could be as normal as a very young fellow of the age of 15 to 20 years to someone who is about 80 to 90 years. So the parameters of a 15 to 20 years fellow will be much much better. Their blood pressure, their pulse rate, their other or functioning organs would be near to the normal, unless there are some conditions which he is suffering from and that are brought to our notice. But a person who is quite old, he could be having blood pressure, he could be having diabetes, he could be having heart disease, some neurological issues. So histories in front of him about the patient he is going to operate. Now, to make a patient fit for surgery is to make them fit for anesthesia as well. Anesthesia involves giving certain kind of medicines, and these medicines could have adverse effect if there are certain unknown conditions the patient is suffering from. For example, if a patient of heart disease who is on anticoagulants and he is subjected to surgical intervention and anesthesia. Now, if a spinal anesthesia is given to a person who has coagulation abnormalities, then there could be bleeding inside spine and which could land him into a catastrophe. So, unless the anesthetist or a surgeon knows what the patient is suffering from, he cannot or he should not decide about operating upon such patient. So that's why it is important on the part of patients to share complete history of their treatment. They should not hide something from the doctor. I find people have a tendency to hide. They very casually say, मेरा ब्लड प्रेशर तो नॉर्मल ही रहता है, इट इज अराउंड 190, मैं एक दो दिन ब्लड प्रेशर की गोली भी नहीं खाता हूँ. ऐसे ऐसे बोलने वाले बहुत सारे लोग हैं. But we have to understand that it is important to take those medicines on time, because unless you take those medicines, your blood pressure could be fluctuating, and drastically it may react in a different way when the patient is subjected to anesthesia. So, to make the patients comfortable during anesthesia, uh, be the surgery absolutely uneventful, one has to do certain investigations. Investigations would generally start with certain basic blood tests. The parameters of the patient should be near to normal, if not absolutely normal, but they should be in the acceptable limit. Now, what are those blood parameters? They involve a common complete blood count like hemoglobin, platelet count, which are important in this situation, or liver function test if it is important from the patient's point of view. If the patient is suffering from conditions uh, close to the liver like cholecystitis, then it is important to have liver function test before the surgery to know whether this condition has affected liver in any way, or whether the patient is suffering from liver condition which can affect our surgical outcomes. Then the kidney function tests, which are important from the point of view of anesthesia, because certain drugs are excreted through the kidney. Now, if we do not evaluate the kidney function and give certain medicines which are excreted through the kidney, then the medicines would have adverse effect on the patient's recovery. So all those conditions like thyroid function test in a patient who is suffering from thyroid, things
Okay, so is there a network issue? Um I'm unable to gauge through my internet. I can see him here, but I cannot see him on the screen. Okay, we'll just wait for some time for him to be back.
Was the connection lost, Surbi? Now you are not audible.
Yes, now. Yeah, the connection was lost actually.
So, okay. Now I was at a point where we had discussed some blood tests.
Yeah.
Then
We were
there
discussing
are
about kidney function, thyroid function, and all of that.
yeah, yeah, yeah.
Yeah.
Now there are certain investigations to assess the condition of heart of the patient, which is particularly important in cases of patients above 35 to 40 years of age, or those patients where uh, the patient has already undergone some heart stenting or some bypass surgery, and to assess the patient's condition before surgery in this situation is very, very important. We need to get a fitness from the treating cardiologist as well. So that's how these tests are very, very important, and that's why they are suggested to the patient according to the severity of disease he is suffering from and the criticality of the surgery he is undergoing.
So there was this question flashing. I'll just flash it.
Is hypothyroidism or diabetes or poor cardiac health or other comorbidities hamper chances of surgery? If so, how to operate on patients with such comorbidities? As I have already discussed, these conditions do have different outcomes on the patients they are suffering from. And to optimize their condition before surgery, one has to get all these investigations done. Like in diabetes, if the patient has sugars which are very high, then he is likely to come out of anesthesia quite late. So, to optimize this condition, we need to control his blood sugar. It is not that he cannot be operated upon, but we need to control his sugars before he undergoes surgery. That is very, very important. In
Yes.
other conditions like hyperthyroidism or poor cardiac health, one has to assess it before the surgery, as we have already discussed. And even hypothyroidism or hyperthyroidism, both these conditions can be controlled before the surgery. Poor heart health, like very poor ejection fraction or pumping of the heart is very, very low, then it can be optimized by giving certain drugs which help in improving the pumping of the heart.
Yes. So I think that answers your question. So moving on, we did talk about the complications of anesthesia कि ऐसा भी हो सकता है, वैसा भी हो सकता है, ये हो सकता है, वो हो सकता है. तो क्या क्या हो सकता है? What can the complications of anesthesia be like, and how can it affect the patient?
Okay. Now, before we go for complication, let us classify anesthesia broadly.
हाँ.
Like I would suggest that there are three main anesthesia drugs which are used for performing surgeries on the patient. One is called as local anesthesia. That means it acts on a part of the body which is getting operated. Like a small corn on the foot, we need not give complete general anesthesia, but it can be done under local anesthesia by injecting small local anesthetic inside the lesion which needs to be removed. So this is local anesthesia. Then it could be a regional anesthesia, like blocking a particular nerve which supplies the complete part, just like giving spinal anesthesia in the back. In between the vertebra there is a space, and through this space we can block a part of spinal cord which supplies the region to which it is going. Generally this is used for lower half of the abdomen or lower part of the body. So that is called as spinal anesthesia. And third one is general anesthesia. General anesthesia means the patient is completely anesthetized, and made unconscious purposefully with the help of drugs in a controlled manner, and anesthetist. In all three situations, anesthetist monitors the patient's condition. So, if you understand local, regional, and general anesthesia, now there could be complications arising from each and every anesthetic practice which is being done on a particular patient. There could be allergic reaction to the local anesthetic which is being used. That's why performing a surgery is one thing, and looking after the complete health of the patient is very, very important in this particular situation. So one has to taste for the allergic reaction to the local anesthetic by giving a taste dose of the medicine. In cases of spinal anesthesia, there could be complication like bleeding inside the spinal canal, or there could be some uh, temporary or permanent damage to the nerves which are getting injected. But those chances are very, very rare. But still, one has to keep in mind, and nobody, not even as anesthetist, does it purposefully. So there could be a complication in this form even in spinal anesthesia. In general anesthesia, the patient could have delay in the recovery. There could be some conditions which go unnoticed during the surgery because of general anesthesia. Patient is unable to complain like pneumothorax or any other problem inside the chest. There could be sudden cardiac event during the anesthesia because the heart was already weak. There could be heart attack during the surgery. All these complications are known to occur, although their incidence is very, very low because we take a lot of precaution before we subject the patient to surgery.
Yes, absolutely. I remember because before my surgery also I was asked a lot of questions by the anesthesiologist कि अस्थमा तो नहीं है, ये तो नहीं है, वो तो नहीं है, regarding all the conditions. And
Correct.
then I informed him, and then likewise he decided कि कौन सा anesthesia suitable रहेगा and कितने
Mhm.
देर में she'll be out of it, and things
Correct.
like that.
Yeah.
Yeah, I also noticed that during the surgery, they constantly keep on monitoring the patient's vitals, कि heart
Yes.
rate कैसा है, breathing कैसा है, ताकि they can immediately inform the surgeon that the blood pressure is dropping or the pulse rate is increasing or whatever, so that likewise the surgeon can manage and
Yes.
look for bleeding or any other complication that has been happening.
Right.
Yes. Okay, so
Anesthetist has a very, very important job during the surgery to make
yeah,
the surgery safe and uneventful. He has to monitor the patient's airways. He has to monitor his blood pressure. He has to monitor his heart rate and different other conditions. He has to monitor the pumping of the heart, and at the same time he has to keep an eye as to what is happening inside the surgery. Is there excessive blood loss? Then he has to uh, alert the surgeons and make the necessary arrangements for blood transfusion or anything which is required during the surgery.
yeah. So before the surgery itself, they are ready. If it's a major surgery, then they are already ready with the blood sample pouches. And
Yeah.
अगर in case कोई ऐसा event होता है sudden bleeding का, so they can
Yes.
transfuse blood. So all these things happen. Okay,
Yes.
so we did talk about pre-surgery preparations and then surgery के दौरान वाले preparations like during the surgery. So now let's come to post-operative ICU stay, and its need. What is the need for the post-op care?
Yeah, it's a very good question, and people do have a feeling that patients are being kept in ICU and we are not allowed to meet the patient, and different other reactions come from the patient once the patient is shifted to ICU after the surgery. Now, why ICU is needed is a very good question. Not all patients would require an ICU. Some patients, like routine surgeries of hernia, hydrocele, appendix, gallbladder, they will be observed for an hour or two in the recovery room. And once they are found to be stable, सब कुछ अच्छा चल रहा है, ब्लड प्रेशर ठीक है, और कहीं ड्रॉप नहीं हो रहा है, कहीं से ब्लीडिंग या ओजिंग नहीं हो रहा है, ऐसा अगर ख्याल में आता है, तो देन दीज पेशेंट्स आर शिफ्टेड टू दी वार्ड, and then the relatives can meet them immediately because they are already out of anesthesia. And mind well, patients are shifted to the room only when we ensure that they are out of anesthesia. So there is no question that the patients are under anesthesia once they are shifted to the room. So those patients who are purposefully kept unconscious for a complete recovery are kept under ICU, in the ICU, for observation of critical parameters. Other patients who are completely out of anesthesia, but they have undergone a critical surgical procedure, which are wherein there could be post-operative complications anticipated because of the nature of surgery. Then those patients also need uh, continuous monitoring. What is continuous monitoring? If you see an ICU setup, you will see number of monitors, number of pumps, number of medicines going on to the patients, number of IV lines. Now, for a patient who needs this kind of monitoring, if he is kept in the ward, he will require a nurse permanently by the side of this patient. What happens in ICU is the nurses patient ratio is about two patients for one nurse. So it is easy for her to monitor. At the same time, there is a specially trained ICU intensivist available round the clock on the duty to monitor the condition of patient and to inform the condition of patient to the necessary doctor. If the patient's sugar rises very high, then it needs to be brought down immediately. Now, what happens in the ICU? The doctor is always available. Once it is noticed that the sugar is high, he will immediately take the necessary steps. In the ICU, the heart rate, blood pressure is monitored. Even a minor change in the heart rate or blood pressure can be brought to the notice of the doctor, who will take necessary steps to control it. Any untoward bleeding through the drains which the patient has can be brought to the notice and will be acted upon immediately. So that's why for certain operations, it is necessary to have the patients under close monitoring, what is called as ICU.
Yes, I completely agree with this. That it is very very necessary to closely monitor such patients, because अगर कुछ untoward हो गया तो ultimately it will be kind of the fault of the doctor, or the
Hmm.
fault of the nursing staff, or basically the fault of the hospital overall.
Yeah,
So
yeah,
rather than that, rather than avoiding those complications, it's better that कभी भी strict monitoring के अंडर रखा जाए, भले ही relatives को एक दो दिन और मिलने ना मिले कोई बड़ी बात नहीं है, but at least patient should go out all healthy.
yeah. Very true.
या तो अभी इस बारे में भी बहुत डिबेट होता रहता है, कि ओपन सर्जरी कराए कि लैप्रोस्कोपिक कराए, कौन सा बेटर है, कौन सा ज्यादा अच्छा है, और किस में ज्यादा कॉम्प्लिकेशंस है, किस में ज्यादा प्रॉब्लम्स है। तो इसके बारे में भी बहुत मिथ्स एंड फैक्ट्स घूमते रहते हैं,
Hmm.
बेसिकली मिथ्स ज्यादा घूमते रहते हैं। सो कुड यू प्लीज क्लैरिफाई, ओपन वर्सेस लैप्रोस्कोपिक, बिकॉज यू आर एक्सपीरियंस्ड इन बोथ।
Yes. When I undertook my surgical training, I was exposed only to the general surgery and open surgery. which was being practiced at the time of my surgical training in the initial days. Uh, but later on, when the laparoscopic training technique was introduced in about 90 or 91, 1991, uh, gradually we realized that there are certain advantages associated with this technique, and uh, the operations which the patient undergoes with the help of open technique and laparoscopic technique have different outcomes in terms of the recovery of the patient. Those patients who undergo open surgery will have recovery quite late, whereas those patients who have undergone with laparoscopic technique, they move out of the bed, or they are discharged quite early in the course of their post-operative period. So gradually, although the laparoscopic technique was initially used only for gallbladder surgeries, other surgeries were also added gradually as the experience of the surgeons increased. And uh, gaining knowledge or getting trained or getting acquainted with your newer techniques is very, very important in medical fields, because that is for the benefits of the patient. Now, initially, what happened? Patient had an apprehension whether they should undergo laparoscopic surgery or not, because they had a feeling that through those small holes which are created on the body, how can a major surgery like removal of a particular organ can be performed? Now, gradually, when the results of these surgeries, patients started seeing those results, they themselves started demanding that they should undergo any operation on their abdomen through a laparoscopic technique because of its distinct advantages. Now, can all the surgeries be performed laparoscopically? I would say no, because in certain conditions, you can imagine if a patient comes with a ghastly abdominal or thoracic accident, where wherein it is important to go in very, very fast and control the bleeding from where it is occurring. Then will the laparoscopic surgery help in this situation? No. There are certain limitations of laparoscopic surgery, and one must understand that the surgical technique which is devised is for the benefit of the patient. If the patient is not going to get any kind of benefit out of the technique which is being used, then surgeon will never insist on performing that surgery with the technique which is not going to help or improve the outcomes of the patient. So there are limitations of open surgery, there are limitations of laparoscopic surgery, and one has to understand that they are not competing with each other, but they are complementary to each other, and that is very important. And a trained surgeon who is trained in open surgeries as well as laparoscopic surgery can decide which is better for his own patients, and this decision should be generally left with the surgeon who is going to treat the condition.
Yes, like I remember that I underwent laparoscopic surgery because it was an elective appendicectomy. तो इलेक्टिव था, कुछ भी इमरजेंसी नहीं था, एंड उसकी वजह से ऐसा हुआ दैट आई ओनली हैव लाइक टू वेरी लिटिल स्कार्स ऑन माय एब्डोमेन. सो कॉस्मेटिकली भी इफ यू टॉक अबाउट अ गर्ल, तो गर्ल्स आर सपोज टू बी कॉस्मेटिकली मोर aware of their body and of their faces. So cosmetically, yeah, it was very impressive that I only had two very little scars on my abdomen, and they aren't even like they're barely visible.
Yeah.
So yeah, in such cases, it helps a lot. लेकिन yeah, definitely as you talked about, जो इतना RTAs like एकदम बहुत सिवियर कोई रोड ट्रैफिक एक्सीडेंट हो गया है, कोई क्रश इंजुरी है, उसकी जो सर्जरी होती है वो obviously it has to be done in emergency, and it has to be done very fast to control the bleeding and to secure the organ that may actually go waste.
Yeah.
So yeah, उस time पे definitely open is necessary. And you used it very beautifully, that they are not in competition with each other, they are complementary to each other, and the decision
Yeah.
should lie in the hands of the surgeon. So that was a very wonderful statement made by you. Okay, so today we decided to discuss two very general and very common surgeries that are performed, that is, appendicectomy and hernias. So
Yeah.
what we'll do is we'll start with appendicectomy.
Yeah.
So, yeah, so could you please tell what is the need of appendix surgery, and can it also be cured by medicines? कि हमेशा surgery जरूरी रहती ही रहती है.
Okay. I'll come to the answer of this question. Now, appendix is a vestigial organ in the human race, and
आप एक बार वेस्टिजियल का मतलब समझा दीजिए ऑडियंस को.
vestigial organ is one which is not performing or which is not helping in any way to the human race. Now,
Yeah.
appendix is such a organ which is attached to the intestine like a small tail. It definitely has some kind of function in the lower animals like dogs, cats, and cows, sheep, everything. But in human race, the appendix has no defined function. So it has become a vestigial organ for the humans. Now, being a vestigial organs, should it be removed in every person? No, it is not necessary, because everybody has an appendix, but only few of them suffer from the condition called as appendicitis. So, what is appendicitis? Appendicitis is an infection which occurs in this vestigial organ. Why does this infection occur? Because this organ is like a small tail. It is attached to the intestine, and it has one end which is blind, other end is communicating with the large intestine at its beginning. Now, what happens to this vestigial organ? There could be some impaction of the fecalith or small stone-like structure, or some seeds, or even the worms which can go inside the appendix and block the lumen of appendix. Now, what happens if there is a blocked lumen of an organ which has only one opening? Obviously, the other opening is blind. Now, if the opening which is communicating with the intestine gets blocked, then what happens? The secretions which are getting secreted inside the appendix would remain inside the appendix. Gradually, there would be stagnation of these secretions. There would be swelling of the appendix because of pressure exerted by these secretions on the appendix. And what happens in cases of intestinal stagnation? There is superadded infection through the organisms which are already present in the intestine. Now, what happens once there is infection in the appendix? The organ becomes turgid, it becomes swollen, it becomes red, it becomes quite thick, and it becomes friable. If the obstruction is allowed to be continued, then this organ is at a danger of getting ruptured, what is called as perforated appendix. And to avoid this kind of complication, one has to undertake the surgery called as appendicectomy by subjecting the patient to this surgery. Now, what happens? The person who is suffering from appendix would initially get some mild pain in the center of abdomen, but as the time progresses, the appendix is generally on the right side. Generally means almost always on the right side of the patient, in the lower part of the abdomen. So the pain also shifts to this lower part of the abdomen, and then the because the pain is not settling down with the usual medicines, the patient seeks the opinion of his or her general practitioner, and general practitioner then refers this patient to the surgeons for further consideration. Now, if the surgeon finds that the patient is suffering from appendicitis, then he has to take the judgment whether the condition of the patient is very severe, or is he very toxic, or whether it needs immediate surgical intervention, and then he advises about the surgical intervention. What is the standard treatment of appendicitis? The standard treatment of appendicitis is removal of the appendix. Will it respond to the medicines? If the appendicitis is occurring not because of obstruction of the appendix, what is called as catarrhal appendicitis, then the chances are that the patient may respond to the conservative line of treatment, and for that medicines can be given. But does it help lifelong? No, it may not help lifelong, because once the diseased organ is kept inside the body, it can trouble the patient at any further date, which is inconvenient for him to get operated. So that's why it is preferable to operate a patient who is suffering from appendicitis. Then there are certain conditions where the patient may not want the surgery immediately. Like, there could be a marriage. uh, if the patient is going for marriage, or if the patient has to appear for examination, or if there are certain important events in the family which the patients want to attend, then these are the situations, or such situations can be brought to the notice of surgeon. And according to the severity of disease, not all appendicitis can be treated with medicines. There are certain appendicitis conditions which can be treated with medicines for time being, but later on the surgery should be performed as an elective surgery, because it is important that the patient does should not suffer from similar condition in future. That can be more dangerous at that time. That can be a day where the patient is not in his town. He has gone out of the towns to somewhere new place, where doesn't know any surgeon there. He doesn't know, he doesn't have any relatives there. And if he suffers from condition like appendicitis at a place which is unknown to him, then he has to subject himself to the surgery at then and there itself. So it is better to get it done at a place, or at a place at a from a surgeon who is known to you, or in your area of comfort. So that's how the decisions on appendicitis, whether surgical treatment or non-surgical treatment, should be taken by the surgeon and not the patient who is suffering from the condition.
Yes, similarly, it happened with me. Like around Feb end, I was treated conservatively. So I had like pain for almost 3 to 4 days, which I couldn't realize. And then once it got shifted to the lower right abdomen, then I realized that probably it's the appendix. And
Hmm.
then when I went, because it was the first attack, so they decided that let us treat it conservatively. But later on, when I got a relapse of this, around 4 months after that episode, then we consulted you, and you decided that it's always better to remove a diseased organ rather than continuing to suffer and have more and more problems in the future.
Yeah.
So, yeah. Okay, so what are the investigations that are required for appendicitis, and what is the approach of this surgery?
See, it is important, as we have seen, there are certain preoperative necessary investigations for anesthesia purpose, and for specifically to diagnose appendicitis, we can do certain blood tests which show increased white cells in the body because of infection. Clinical examination is very, very important, and a doctor or experienced surgeon can diagnose the condition immediately. Then, in doubtful cases where there could be a doubt whether it is a right sided ureteric stone, or appendicitis, one can take help of ultrasonography, or if at all required, if ultrasound is not enough to diagnose it, then even CT scan may be required to be done. For patients who are suffering from chronic appendicitis, the organ becomes quite thickened and the patients do get intermittent pain. And for these uh, clarity of the diagnosis, one may take help of normal blood tests, ultrasonography, or CT scan as per the physical findings of the patient or as per the clinical assessment done by the surgeon. Not all the patients would require sonography, not all the patients would require CT scan. A basic blood test and clinical examination is enough for the diagnosis of appendicitis.
Correct, correct. Okay, so now moving on to the last segment of our today's session, those are hernias. So, could you explain to the audience what a hernia is and what are the various types of hernias?
Hernia is another common condition which a person, he or she, can suffer right from the newborn age to a very, very old age. Newborn babies may also suffer from conditions like hernia, or the old patients, maybe 80, 90, 100, can get hernias in their age group also. So, what is hernia? Hernia is a condition where there is protrusion of a organ from the cavity in which it lies, and the organ or the bulge becomes visible on the skin. So, protrusion of a viscous or a part of viscous through the cavity in which it lies is called as hernia. What are the common sites of hernia? In a male patient, the common site of hernia is both the groins, right or left, where the testes of a person do come to lie in the lower part of the scrotum. They traverse the abdominal wall through the abdomen into the scrotum, and for that they create a path of their own. Now, if this path becomes little more, then there could be herniation of intestine or omentum, which are inside the abdomen, into the inguinal canal. That is called as inguinal hernia or a groin hernia. There are certain weak spots, inherent weak spots on the abdomen, like these groins in cases of males, then umbilicus in cases of males as well as females. Generally, groin hernias are more common in males, but it is not that they do not occur in females, they can occur in females as well. Then, umbilical hernias are more commonly seen in females because generally females after their pregnancy have too much of stretching of their abdominal walls, and the potentially weak spot at the umbilicus through which a infant is connected to the mother can become, this weakness can become exaggerated, and through this weakness there could be herniation of a viscus or a part of viscus. So umbilical hernias are more common in females. Groin groin hernias are more common in males. Apart from this, many a times the hernia can occur in the previous incision on the abdomen of a person, what is called as incisional hernia. Like a person has undergone some abdominal surgery, and this scar of this abdominal surgery in future becomes weakened because of weak stitches or some chronic cough which the patient suffers, or if the patient puts on lot of weight, there could be excessive stretching of this scar, and a part of scar or a complete scar becomes weak, and there could be herniation of the abdominal contents through this scar, what is called as incisional hernia. That means hernia occurring in previous abdominal incisions. So these are the different hernias like groin hernia, umbilical hernia, and incisional hernia, which are visible externally. There are certain hernias which are not visible externally, but they have some impact on the condition of the patient, like what is called as hiatus hernia or diaphragmatic hernia or interstitial hernia, or hernias occurring inside the intestinal loops. Now, these hernias are not so common, but and at the same time they are not visible externally. So there are certain specific tests which are needed to diagnose these kind of hernias, which are inside the cavity of abdomen or inside the cavity of abdomen and thorax. So these are the different kinds of hernias.
All right. Do you want to have some water?
No, no, that's fine.
Okay, it's fine. Okay, so the same question here also कि इसमें कंजर्वेटिव मैनेजमेंट करना चाहिए, दैट इज सिर्फ मेडिकेशंस या फार्माकोथेरेपी देकर, कि सर्जरी इज नेसेसरी, एंड इफ सो व्हाई?
Okay. Uh, now, the hernia, a patient might be suffering from hernia for a number of years, and suddenly he lands in a complication. What is the complication that is likely to occur? Intestinal obstruction. Because the loops of intestine go inside the hernia, they come back into the abdomen, and likewise, if the to and fro movements of intestine is continuous, then he may not get intestinal obstruction. But if at all the loops of intestine which have gone down into the hernia, they get obstructed, then there could be severe emergency, and patient could land into complications like uh, intestinal obstruction or perforation or even gangrene of the loop of intestine which is obstructed inside the hernia. Now, does every hernia land into this complication? No. When can this complication occur? Nobody can predict. Even surgeon cannot tell when this complication can occur. As I said, hernia is a condition which needs primarily surgical treatment. Now, if there are certain conditions or certain situations or certain circumstances where it if the surgery cannot be performed because of poor health of the patient, or very old or fragile patient who cannot sustain the anesthesia, or to the patients who has a lot of comorbidities like very bad heart condition, or where the anesthesia cannot be given, then only one should avoid doing surgery. Otherwise, primarily the treatment of hernia is surgery, and it should be treated by surgery. It is luck of the patient if he doesn't land into complication throughout his life, but there are certain situations where it can cause a lot of discomfort, and for that the patient has to suffer from that discomfort repeatedly. To avoid, again I'm saying, the patient should be in familiar condition whenever the surgery is occurring. If he lands in a obstruction at a place, he has gone for roaming around outside India or in distant place away from his hometown, and if he lands into problems like intestinal obstruction, then what will happen? He has to either rush back to his uh, town of his living where he can undergo surgery, or he has to undertake surgery at a place where he has landed into complications. So this can lead to lot of family. The family has to bear a lot of stress during this period, and to avoid this kind landing ourselves into these conditions, it is important that elective surgical operations should be done for hernias before landing the patient into complications.
Okay. All right. So properly put, actually. So what are the again the same questions as we asked in appendicitis, appendicectomy actually. So what are the different kind of investigations that are necessary in this type of surgery, like before performing hernia surgery?
Okay. Now, as I have already mentioned, there are certain hernias which occur inside the abdominal cavity, which are
Yes.
not visible from inside. Then those conditions would require either endoscopy or CT scan to its diagnose these conditions, as well as to assess the problems which are already created by these conditions. Now, to understand the anatomy of these patients who have hernias inside the abdomen, one may need CT scan examination or ultrasound examination, or a X-ray with some barium or dye given to the patient, and this dye passes through the intestine, and then one can do a X-ray to see what is happening with the intestinal loops. So, barium studies, sonography, or CT scan may be needed for hernias which are hidden from external view. For inguinal or groin hernias and for straightforward umbilical hernias, it may not be necessary to do any kind of investigations. But we generally do it to be on the safer side, just to know any preconditions which the patient is suffering from before undertaking the surgery. Like a patient of umbilical hernia may have gallstones. Now, a patient who is likely to have problems because of gallstones, if he is undergoing surgery for umbilical hernia, one can consider elective operation for gallstones. So, in that way, doing a sonography just by moving a probe of ultrasound is good enough to diagnose condition. And apart from that, uh, simpler hernias will not require any other investigation to diagnose its condition. For anesthesia purpose, we have already discussed that there are different investigations which are required. In cases of incisional hernias, it is important to know the size of hernia because the hernias would require placement of mesh for its repair. To calculate the size of mesh, one has to know the size of hernia defect. And in incisional hernias, the hernia defect can be measured with the help of CT scan. The contents of the hernias, whether it is intestine or some omentum or any other organ, can be assessed with the help of CT scan. If the patient has already undergone previous repair for hernia surgery, then whether the mesh was used or not, or what kind of repair was done, can be assessed with the help of these investigations. So, once it is decided that we are going to operate upon a hernia, in cases of incisional hernias, it is important to get a CT scan done to plan the surgery in a proper way.
Yes. So we did discuss some of the complications of hernia, like basically, intestinal obstruction, mental obstruction, vagare vagare. Would you like to add to certain complications, or shall we move ahead?
Uh, Most of the conditions we have covered.
Yeah,
uh, these complications would only mean that the surgery has to be done on priority, whether
priority.
the patient's physical condition is stable at that time or not, one has to take the risk of operating upon such patients. So, to avoid any kind of rush or rash situations, it is better to do any surgical procedure electively.
Yes. Okay, so we have come to the last part of the hernia discussion. That is basically what is the approach of to the hernia surgery, and now we use a mesh in that. So, what is a mesh? Also, you could explain along with the hernia surgery.
Yeah, very, very important issue because I come across number of questions regarding the mesh or what is mesh? Mesh is a barrier. What is the barrier required for? Because hernia occurs through a defect. What is defect? That there is weakness in a particular part of the abdomen through which the intestine or any other organ pops out. So, to cover the weakness, one can either use stitches, but it has been observed that only suturing or giving stitches to the weakened area would further weaken this particular part because you are taking stitches through the weakened area. Now, this weak area may not hold the sutures. It may not heal as per the expectation of the patient or as per the expectation of the surgeons because of different other conditions. So, to and furthermore, putting stitches on a weakened area would put further pressure on this area and that would lead to further weakness. So, to avoid any kind of pressure on an area which needs repair, we use some barrier. Now, this barrier is a artificial material manufactured out of polypropylene or polyester. Generally, these two materials are used as medicated materials and meshes for covering the defect. The defect is then covered with the help of mesh, and this barrier acts as a stop for the further occurrence of hernia. Now, these meshes are manufactured of polypropylene and polyester meshes, which are very commonly used in India, and these are placed at critical points where the weak portion is. And it is important that these meshes spread around this weak area furthermore so that they get a grip on a good healthy area. So it is necessary to fix these meshes with some kind of either suture fixation or tacker fixation or some there are some self gripping or self fixing meshes which are used. So there are different kinds of meshes used in different situations, and a surgeon is able to take a proper decision where mesh needs to be used and which type of mesh needs to be used. These meshes are available in different size as per the size of the defect which they are going to cover.
Yes. So, coming to this, we did discuss the complications of hernia, but there any complications of this hernia surgery as well?
Yes, this mesh being a foreign material or the sutures being foreign material, patient's body may not accept it. They may react to this material. Generally, these are manufactured out of a inert material and they are time tested materials which are used. These being foreign materials, they, they may carry a risk of harboring infection inside the patient's body, and this may lead to the pus formation, and this may ultimately require removal of this mesh. So, there could be complications related to surgery. There could be complications So these may lodge some infection and which may require further removal of the mesh, and there could be recurrence in the hernias, there could be adhesions of intestine to these meshes, there could be perforation of the intestine. But all these complications are very, very rare. They are not so common. They are less than 1%. And these materials are being used for years together with very reasonably good outcomes.
So the basic message out of this is that it's always better to get the surgery done because the complications are less than 1%. So they are very rare. So it's always better
Yes,
to get surgically operated and be free of this for your entire life.
yes.
So now that we have almost finished all the topics that we had decided to discuss today, would you like to give some of your closing comments to the audience regarding surgery and what are the basic, what you would like to
Yeah.
guide them with? Yeah.
Now imagine a situation where in a family, one person is suffering from a condition which requires surgical intervention on priority. Now, the first reaction of the patient is that no, I will not undergo surgery. Second thought that comes to his mind is why only me? What I have done? Why should I suffer from this condition which needs surgery? Third is it absolutely necessary or can I live with it? So, all these thoughts can come into the mind of patients, their relatives. There could be some financial issues. But remember, the surgery is not to trouble the patient, it is to make his life comfortable. And if there are likely complications which are dreadful and difficult to treat in future, then it is better that patient does undergo this surgery on priority with the help of a proper counseling, as well as if there is any uh, difficulty in decision making, then he can talk to his surgeon maybe once, twice, get his all doubts clarified, and then go for the surgery electively and with very positive mind, because keeping yourself positive during critical situations, even in life as well as during surgery, can have different outcomes. And it is important that a event like surgery, if patients faces bravely, then I'm certain and sure that the outcomes would be much, much better.
Yes, as we actually discuss in psychiatry and even in palliative psychiatry, rehabilitation psychiatry, we do discuss about these things कि अगर patient positively surgery के लिए जाए and even post surgery if the patient is not depressed and the anxiety levels are lower, then the outcome of the surgery is better and the patient also feels better within a very less span of time.
Yes,
And yeah, so they don't have to then revisit surgeons constantly or they don't have much complications. So that is where we also come into the picture many times because post surgery a lot of patients are depressed, or
yeah,
even before surgery they are so anxious that they just deny giving consent, and
yeah,
that is where we have to go for counseling.
very true.
Okay, so thank you so much, Mukund Uncle, for accepting this invitation and coming on board and sharing
Yeah,
your views and your knowledge about surgery and two of the major surgeries that we discussed today, that is appendicectomy and hernia surgeries. Also, I had thought that we would only go on for 40-45 minutes as there is only one speaker today and the topics are not those many. But because this session was so informative and knowledgeable, we have exceeded our time limit to even 1 hour, 11 minutes now. So
yeah.
it was wonderful having you.
Thank you so much. Nice interacting with you. All the best.
Thank you. And we also have a lot, many more surgeries to discuss. So we will definitely come up with a part two whenever you are free, and we will
Yeah,
discuss about those surgeries as well. So,
very.
thank you to the audience who attended today's session. I hope it was very informative. And if you also found it very informative and knowledgeable, do share it with more and more people. Do like and comment, and also comment as to what you would like us to cover in our future sessions. We also have a phone number flashing at the end of the session on the poster. You can contact us on that for any help. You can also contact us if you want to enroll into the F1 app, and do subscribe to our channel. Take care and good night. Have a happy Saturday night and enjoy.
Yeah, thank you so much. Bye bye. Good night.